As you may know, 25 to 30% of overall medical costs are actually unnecessary and avoidable. If you were to break down a typical health plan's costs, they'd look something like this. Approximately half of these avoidable costs are due to physician and hospital overuse, abuse, misuse and incompetency, while the other half can be classified as avoidable drug-impacted medical costs, such as unnecessary ER visits, hospital admissions and readmissions, and rapid patient movement due to higher risk bands. These costs are due to adverse drug events, duplicate therapies, poor adherence, absence of personalized care plan-driven vital sign monitoring, lack of actionable intelligence-driven timely care coordination, and missing social connection for those patients who are depressed, lonely, and without family support. Today, health plans, PBMs, doctors and patients are completely neglecting these costs. This presents an immense opportunity for cost savings. Introducing nirvanaAccountableCare from Rxadvance, the comprehensive solution that enables collaboration amongst care continuum stakeholders to transform cost into shared savings for all parties: the payer, provider, patient and Rxadvance. nirvanaAccountableCare is a home care coordination solution that reduces avoidable drug-impacted medical costs in 8 steps. Opportunity analysis, comprehensive medication review, duplicate therapy reduction, adverse drug event reduction, electronic pill tray delivery, adherence monitoring, vital signs monitoring and care coordination, and chronic care management. Rxadvance's proprietary algorithm integrates the medical, pharmacy and lab data of all health plan members and then distributes these patients into 5 distinct risk bands. High-risk patients are identified as nirvanaAccountableCare eligible. Next, when an eligible member visits his primary care physician, Rxadvance alerts the physician within his or her workflow that there's an opportunity to improve the patient's health through nirvanaAccountableCare services. This alert also identifies the reward for the physician for enrolling the patient in nirvanaAccountableCare services. The member and physician agree upon a personal medication list that will optimize both savings and patient health through the elimination of duplicate therapies and adverse drug events. As you can see here, in the case of Mr. Schultz, the number of medications have been reduced from 13 to 9 to reduce adverse effects and improve overall quality of life. Following which, patients are educated about nirvanaAccountableCare. nirvanaAccountableCare services include Nirvana Smart, the home care coordination gateway. Nirvana Smart provides medication adherence management, Bluetooth-enabled vital sign monitoring through provided devices, weekly delivery of pre-filled disposable pill trays, and a platform that coordinates all individuals and information vital to the patient's health and well-being. Following enrollment and education, the patient is contacted by an Rxadvance care advisor, who's responsible for coordinating the deployment of Nirvana Smart to the patient's home through a designated field installation professional. Once set up in the home, Nirvana Smart will notify the patient of when it's time to take his or her medication with voice alerts.
Hello, Grandpa. Please take your noon medication. We love you.
All these medications are neatly packaged in an electronic disposable pill tray, providing convenience to patients and ensuring that the correct medications are taken at the appropriate time of day.
Hi, Grandpa. Please record your blood pressure measurement.
Nirvana Smart will further remind the patient to capture vital sign measurements and to schedule timely primary care visits to capture HEDIS measures. Nirvana Smart also derives actionable intelligence from its knowledge of the patient's age, gender, weight, disease conditions, medications and vitals. Using this to inform all care stakeholders, including family members, caregivers, physicians and health plan case managers, of the patient's status. If care is needed after hours, a designated pager physician will visit the patient at his or her home. This pager physician will also facilitate any addressable HEDIS measures and appropriate diagnosis for enhanced risk score payments. The truly comprehensive care coordination services provided by nirvanaAccountableCare will lead to a substantial reduction in avoidable drug-impacted medical costs. The resulting cost savings will be shared amongst all stakeholders: the plan, primary care physician, patient and Rxadvance. Never in the past has a single entity taken the accountability to reduce avoidable drug-impacted medical costs throughout the care continuum, nor share the rewards with all stakeholders. nirvanaAccountableCare from Rxadvance. Reduce avoidable drug-impacted medical costs. Improve patient quality of life. Share cost savings with all stakeholders.